各位
Friends of the media, good afternoon, good evening. Thank you for coming to the media and stand-up. The chief executive will first make some remarks and then she'll take questions from the floor. Because of the severe epidemic, please try to keep your distance in this briefing session. Now I'll invite the chief executive to speak. Friends of the media, members of the public, today I would like to give you a full account of the overall action plan of the SL government at this stage of the epidemic. Last Friday, I made an announcement after the agreement of the Executive Council to invoke the emergency regulations to delay the chief executive election to the 8th of May because we are in a critical stage of fighting the epidemic. So that this media stand-up echoes that meeting. But my opening remarks will be rather lengthy, but still I will allow sufficient time for questions. Now, for most of the work we're doing, we have the support of the country. So I would like to give you an account on the various forms of national support that we receive every day from the central authorities. Now, of course, I don't need to tell you how critical or how severe the epidemic is. We're in a very critical stage. The fifth wave of outbreak will involve the highly transmissible Omicron, and then unfortunately there was also the situation of imported cases from hamsters with the Delta strain. And this happened at an unfortunate time just before the Chinese New Year. Now we have made many appeals, but of course around Chinese New Year there were family gatherings, in particular cross-family gatherings, and so we've seen the exponential surge in the number of confirmed cases. Now, for the fifth wave of outbreak so far, we've recorded 53,943 confirmed cases, and that includes the figure just announced at the 4:30 press briefing just now by the Center for Health Protection. And this number is 4 times the aggregate number for the past 2 years, so you can imagine how severe this epidemic is. Also, the number of theft cases is another concern. Since the fifth outbreak, and including the figures announced by the hospital authority just now, so far we have 145 death cases. Many elderly persons and those with underlying conditions, and there were 3 cases of death involving infants, and so this is very worrying. We need to look into the cause of those cases. And then for the of 145 death cases in this fifth wave of outbreak, that's almost 60% of the total for the past 2 years. Now, just now you saw 2 charts. That's what happened since the fifth wave of outbreak. And from our monitoring of sewage, we can see that the virus is still spreading widely in the community. One of our monitoring systems involves sewage. The Environmental Protection Department, the Sewage Service Department, and the Hong Kong University teams have been constantly monitoring the sewage discharge in Hong Kong for the past 1.5 years. That's sentinel monitoring, where they take samples at fixed locations covering 1 million people. And then there are also other sample taking locations. Now the figures, the text is small, but here for the red column it shows that it shows the viral load of in the sewage. The darker the color, that means the higher the viral load. And so with a high viral load detected, then we will do restriction testing, declaration, and closure. And then you will find the preliminary positive cases. The gray column shows the preliminary positive cases identified, and you see the percentage here. If, say, where we do a restriction testing declaration, RTD, covering 1,000 residents, in early February, we would find about 5 cases out of 1,000 residents, so the percentage is 0.5%. So, as I said, that means in every 1,000 residents, we would identify 5 preliminary positive cases. But in recent days, as you look at the gray column, you see the percentage gone up to 2 or even 8 in serious cases. That means with 1,000 residents tested, we would find 20 to 80 preliminary positive cases. That shows, therefore, in the community, we still have many hidden transmission chains. The SL government has always shouldered main responsibility in fighting the epidemic, but now we have received staunch support from the central authorities. I need to reiterate our policy in fighting the epidemic. That is, we try to prevent local infected cases and imported cases. We adopt a multi-pronged approach to try to stop the virus. Through early identification, early isolation, and early treatment, our target is dynamic zero infection. So we have various measures to try to contain the virus, and with only one objective, that is to protect the lives and safety of the public and also to protect their health. Now, if you look at the chart, you can see in the past 2 years, our strategy has worked well. We have a very low death rate when compared to other parts of the world, and then we had just over 10,000 confirmed cases in the past 2 years in total. So that's a very small number. So for before, or rather, these strategies worked very well. It's helped us weather the past 4 waves of outbreak. But for this 5th wave of outbreak, it came on us rather rapidly. It raged on rather rapidly, and we've worked very hard to try to contain the virus, and we've made adjustment to our strategy in the light of the latest development of the epidemic. But with the rapidly evolving epidemic, we no longer have enough capacity to cope. That's why we need support from the central authorities for us to fight the epidemic. And I have submitted a report to the central authorities putting forward our request. Now, since the reunification, we want to ensure the steadfast and successful implementation of one country, two systems. The central authorities have always been behind us staunchly when we have various challenges, and this time it's the same again. Now, the Central People's Government attaches great importance to our epidemic. They care very much about the well-being of the people. That's why they're giving us strong support very rapidly. Now, the chairman of the country, the president of the country, President Xi Jinping, has made important instructions to make sure that we will mobilize all necessary resources and forces completely, and then we will ensure, the safety of the public and stability and so on. And then Mr. Xia Baolong is now in Shenzhen. He is chairing almost daily coordination meetings to give us support. And in the past 8 or 10 days, there are various forms of assistance have been given to us. I will briefly mention them. First, in boosting our testing capacity, because if we want to have early identification, we must have sufficient testing capacity. So there are some those involved in sample collection, and there are mobile testing vehicles and so on who've come over to Hong Kong from the mainland. And then at 3 sports stadium, new laboratories have been set up, whether they're called Huoyan laboratories or inflatable laboratories. These have been set up, and so we could boost our local testing capacity. Of course, with PCR test, that has to do with the universal testing. We will need a large quantity of that. I will talk about that later. The second is about providing us with the various supplies, medical supplies, such as RAT kits, N95 masks, proprietary Chinese medicine, personal protective equipment, and so on. These have all arrived in Hong Kong in batches. And then Mr. Yao has been interviewed on that recently. And the third, as former support is to build community isolation and treatment facilities. We will be explaining where we're setting up these facilities lately. Fourth form of assistance is the mainland. The central authority is very much concerned about the supplies of fresh food. Now, because we have cross-boundary drivers with infection, we've seen quite a number of those cases, or if they live at the buildings with confirmed cases, then there won't be any exemption for these cross-boundary drivers from quarantine arrangement if they want to go into Shenzhen. That's why there is a drop in the number of cross-boundary drivers, and that has impacted on cross-boundary cargo transportation. So that's why the main authorities have made another arrangement. They have now set up a sea route for the transportation of fresh fruit supply. And apart from Mankam Toll, we also will be making use of the Lantang Hangyun Wai cross-boundary crossing as another temporary emergency port for the importation of fresh food. Fifth form of assistance is sending experts here. Some epidemiologists have arrived in Hong Kong. They will be helping us with our fight against the epidemic. And the next batch of experts are those experts on serious diseases.
The coming 2 or 3 months would be crucial in fighting the pandemic, and we hope to stabilize the pandemic in the meantime. And we must reinforce our efforts in a number of areas, which I would explain in a moment. First of all, early detection, early isolation, and to curb the transmission chain of the virus. And we must continue to offer treatment, and we must carry out some diversion on the patients, and we must prevent the importation of cases, further tighten social distancing measures in order to curb transmissions. And finally, we must enhance the vaccination rate in Hong Kong, especially among the elderly and children. And as such, as I will explain in a moment, most measures will be extended till the middle or the end of April. In other words, the social distancing measures will no longer be reported or updated every 14 days. Legally speaking, the Secretary for Food and Health would announce an extension of measures every 14 days. But I would say now that the relevant measures will not cease after 14 days. They would be extended till the middle or end of April. In order to carry out the work in the next 3 or 4 months, today I would announce adjustments to the school arrangements in the 2021-22 academic year. The summer break, which would take place from July to August, would be brought forward to March and April, so that we could focus our energies on fighting the pandemic, and the school campuses could be used by the government for testing purposes. If we are to carry out universal testing, we would need a lot of testing venues, and these campuses could also be used for isolation and vaccination. And 3 or 4 months later, our students can return to school in a safe manner. And this arrangement would apply to all kindergartens as well as primary and secondary schools in Hong Kong, including international schools and special schools, but not including tertiary institutions. Some universities have already asked their students to leave the student hostels, and there will not be any face-to-face lessons before August. So we would leave it to the tertiary institutes to make their own decisions. We will confirm the arrangement in early March so that schools would have ample time to make preparations. If you remember, the class suspension will continue till early March, and by then the school holidays would begin and online learning would stop. In other words, school principals and teachers will not have to go back to school to prepare teaching materials, and that way the school campuses could be vacated for the purposes I mentioned. And time would be afforded for parents to make arrangements to take care of their children, and school would resume after the Easter holidays. The last day of school would be the 18th of April, and after the holiday, school would resume. For the Hong Kong Diploma of Secondary Education examination, we are aiming for the DSE to begin at the original date of 22nd of April. In the past, we managed to keep the dates of the DSE exams unchanged for Secondary 6 students. So this year, we are aiming for the DSEs to begin as scheduled on April the 22nd. According to our plan, local primary schools and international schools could first resume face-to-face lessons, while secondary school students would continue to learn from home till the DSE exams or the DSE core subject exams are completed before face-to-face lessons are resumed. Since the summer break is brought forward, the final school day of the 2021-22 academic year would be August the 12th this year, while the 2022-23 academic year will begin as scheduled in August or September. The Secretary for Education is working with university organizations, and hopefully the universities would collaborate with the government to put in place such arrangements. Or else it would not be possible to vacate more testing or vaccination venues for our students. In terms of reinforcing our capabilities to detect cases early, we will implement compulsory universal testing or CUT within 3 months. The CUT is legally binding. Cap 599J empowers the Secretary for Food and Health to issue compulsory testing notices. She has been issuing compulsory testing notices every day, so those who do not take the universal tests would be held liable. And we hope to carry out 3 such tests during the period. In order to identify most hidden cases. With the support of the central government and local testing contractors, including the air-inflated laboratory I mentioned, we hope the sampling and testing capacity could be raised to no less than 1 million per day. So since we have a population of some 7 million people, testing would take about 7 days. And we believe the capacity could exceed 1 million per day. We will set up a few hundred testing centers across the territory. And for the universal testing drive in 2020, we set up a number of community testing centers, and we tested 1.78 million people in 2 weeks. And this time, we will carry out 3 tests for our 7 million population. So this is compulsory testing instead of voluntary testing. So we must verify whether everyone has been tested. For the details, they would be announced by relevant secretaries. Testing would be based on the Hong Kong identity card numbers, much like the smart identity card replacement exercise. Bookings are required, and testing would be based on the ID number and year of birth. We know that there are scenarios in which couples or residents want to get tested together with elderly family members. So we would allow people receiving tests to bring along two children or elderly family members. If there could be a break of a few days in between the 3 tests. So we hope for every resident subject to compulsory testing after they complete each test. Items would be distributed, and these include rapid antigen test kits. If there is a 5-minute gap between the consecutive tests, we would give them 5 kits. If the gap is 7 days, we would give them 7 kits so that they can take the RATs at home. And we would also distribute the more protective KN95 masks or masks of an equal grade. That is why we have purchased hundreds of millions of test kits and masks, and these were to prepare for universal testing. Before CUT is implemented, we believe that CUT would be carried out by March. So the test would be carried out in the morning, in the afternoon, and at night, and buildings would be put under RTD for testing. Even after compulsory universal testing, we will continue to use testing to monitor the pandemic in Hong Kong and to prevent transmission. We just talked about early identification, and that gives rise to another issue, that is early isolation. For confirmed patients, whether they exhibit symptoms or not, they should not stay at home and they should be isolated as soon as possible. That has been our strategy in the past 2 years. Only by isolating them can we avoid further infections of household members. However, we must admit that our isolation facilities are severely inadequate, and we understand that manpower is needed to operate these facilities. So given the severe outbreak, there is a severe shortage of facilities. We believe 30,000 confirmed or preliminary positive individuals are still waiting at home for admission to community isolation facilities or hospitals. For most Omicron cases, the symptoms are mild and the patients experience mild upper respiratory tract discomfort, and we ought to provide support to these individuals. The support offered might not be efficient enough. That is why I have urged the Department of Health and Hospital Authority to provide better support for these individuals. The support includes the distribution of electronic wristbands, anti-epidemic kits, the setting up of a medical inquiry hotline, booking service for specified clinics, and dedicated taxi fleet to offer point-to-point transportation service for these individuals, but we reiterate that isolation is still our policy objective.
So that's why we're working very hard with the full support of the central authorities to build more isolation facilities so we could take in those who are tested positive, who are either asymptomatic or with mild symptoms. We have at the moment about 5,000 such units at Penny's Bay, because as you know, the Penny's Bay Quarantine Center has been turned into an isolation center. We also have about 1,600 hotel rooms used for community isolation purpose. And within this month, because there are just and then we will be able to double the number from 5,000 to about 12,000 units. That will include units in 3 blocks of public housing estate where there's not been any population intake. And then there will be more quarantine hotels becoming isolation hotels. That's the situation in February. And then in March, we will have another additional 16,000 units in phases. This will come from more community isolation hotels and the conversion of the Kai Tak cruise terminal. So that will be the situation in March. With the support of the central authorities, we are going to do the following. At vacant sites, we are building isolation facilities anew. And you might recall last Saturday I attended a ceremony to start the construction of isolation facilities at the site next to Penny's Bay and the Kai Tak cruise terminal. In the next few months, these units will be completed in phases rather than in one go. But then there's no need to wait for a few months for all these units to be completed. In phases, we will be providing another 10,000 units. And then in a short space of time, we're able to decide on another 5 sites. And now we need to talk to private developers. And also, there are mainland construction teams deployed by the central authorities. They will have to check out this site, and then we will be able to provide at least 20,000 units. The biggest site is at Lok Ma Chau Loop. This is the site for the Innovation Technology Park, but then this is a huge site, so even if we build isolation units, that won't affect the progress of the development of the Innovation Technology Zone. And then we're using the eastern corner of the site. And then there are also private lands offered to us for free, and we're very grateful to the developers concerned. And then there are also government sites. And in any case, we will have to check how many units we could actually provide on this site, and then we will come back and tell you. Now, Mr. Michael Wong and his works departments are all working very hard. In these past few days, actually, Mr. Wong has been going to sites every day to see how many units we could actually build on these sites. Of course, we are still in discussion with other developers on sites they could offer. And then, say for universities, the sports ground, we could build on that too. And then there are other charitable groups trying to offer help as well. So we're still looking for more facilities, and maybe we could also provide the facilities at some sports stadium. But you don't forget, we need many venues for testing, for vaccination, and for isolation. So in any case, there is strong demand for community isolation facilities from the public. So recently I have directed departments to look for isolation facilities for their own staff if they have a need for that, or for their own people. For example, the Correctional Services Department has managed to identify isolation facilities for colleagues of the Correctional Services Department, and then Marine Department will be able to convert the China ferry terminal into isolation facilities. So I have asked the departments to look after their own isolation needs as far as possible. The same applies to universities. Well, in fact, for confirmed cases involving students or university staff, they are isolated in the university hostel facilities. We've given them all the support from the Department of Health and the Center for Health Protection, so they're able to make their own isolation arrangement. And even the MTRCL is looking for site for isolation of their own staff where necessary. That in that way, they won't be adding to the burden of the community isolation facilities. For residents in the poor housing condition and with isolation needs, then they could be put into these facilities. And another aspect is about enhancing our early treatment capacity. As I mentioned, Omicron compared to other variant strains of COVID-19, it's relatively mild, as pointed out by Dr. Lau. There are 49 cases in serious or critical condition today, as he reported. Now, the public hospitals, of course, are the only only places where serious cases could be treated, but then there are many others with mild conditions, and they are overburdening our accident and emergency department. And then, of course, for the hospital authority, they have negative pressure wards and other isolation facilities, and we're grateful to the central authorities for helping us to build the community treatment facilities with 1,000 beds at the Asia World Expo with the help of the country last year. So without these facilities, we'll be in an even more dire situation. Anyway, there are now 3,000 beds of isolation beds, and then at the AWE, there's always been 1,002 beds in the community treatment facilities, and the central authorities the year before helped us to build a temporary hospital with 820 beds. And then the central authorities, in response to our request, will help us to build another emergency hospital. It will be probably similar to the temporary hospital previously built. And in recent weeks, we've seen elderly people who had to be stranded outside in a tent for a prolonged period, because the accident emergency departments were overwhelmed at public hospitals. And as I said before, this is unacceptable. Now, the government has identified a facility with the help of a welfare organization to have a referral center, to have a occasional care center. And elderly there could be they have to be referred by the hospital authority, and say maybe some elderly residents have mild conditions, but they cannot stay in elderly homes, and so they could be sent to these treatment and occasional care centers. There's one center opened in Kwun Tong, another one will be ready in Sakip Mei, and these venues are actually sports stadia. So we have used 2 sports stadia for this purpose, but I've said we may need the sports stadia for other purposes, such as vaccination and so on. Anyway, for our strategy to prevent imported cases, all the measures have to be extended. It's no longer 14 days of extension each time, as I said earlier. Now, there are now 9 countries subject to the circuit breaker mechanism. That means flights are banned from these places. But then there are many people coming back from these places. So that means they will bring back many arrivals. And then this circuit breaker arrangement will be extended to the 20th of April. But really, we don't have a choice, and we are sorry if that causes any inconvenience to those who are waiting to come back to Hong Kong, or others may have already booked quarantine hotels to come back here, but I'm sorry you won't be able to come back before the 20th of April. We'll, of course, monitor closely the the epidemic. If necessary, other countries may be included in the list, but then in some countries, if the epidemic situation is not so poor, then they will be taken out of the list. And we will continue to adhere to the circuit breaker mechanism and ban flights from other places as necessary. On the tightening of social distancing measures, now we are launching the vaccine pass this week. This is one form of tightening social distancing measure. If you are not vaccinated, you won't be able to access many premises. This is meant to encourage keeping social distance and also vaccination. But then, of course, for scheduled premises under Cap 599F, they are not yet open to business. And here I would like to announce that for the series of social distancing measures that are to expire at midnight on the 23rd of February will be extended every 14 days until the 20th of April. According to law, the extension can only be 14 days at a time. So we will be extending these measures every 14 days for a longer period. Of course, that means there still won't be evening dining service, and many of the scheduled premises have to stay closed. This is not good news to the sectors affected, but really at this stage of the epidemic, we have no choice but to take these measures. As for the details of the tightened measures, the Food and Health Bureau will be announcing further details later. For daytime dining service, there will be further tightening of measures. For example, instead of 4 persons a table, there will be tightening of that. In any case, the Food and Health Bureau will be announcing the details later. Now, I would like to talk about boosting the vaccination rate as soon as possible. Now, if we could, if people are vaccinated, there is no doubt that this is effective in reducing the chances of death or serious complications. And we can see actually there are more people willing to get vaccinated. For those who have taken the first jab, the percentage is 86.4% of the eligible population. Those who have taken the second jab is the percentage now 76%, and for the third jab, now 1.49 million people have taken that. We keep increasing the vaccination capacity, so people who want to get vaccinated could get vaccinated. By the end of February, we'll be able to administer 85,000 doses per day on average. But of course, on some days, we actually administered 100,000 doses because there are private doctors administering the vaccine as well. So private clinics are extending their service hours, or they are doing outreach service to help boost the vaccination rate. We've also added more vaccination centers, and as hospitals, they will also extend the hours for vaccination.
3月初
In terms of our overall objectives, we hope that by early March we can achieve a 90% vaccination rate for the first dose, and we believe this target is attainable given the current pace of 30 to 40,000 doses per day. For the second dose, we hope to achieve a vaccination rate of 80% by mid-March. For the third dose, the situation is more complicated. Only people who have administered the second dose for at least 6 months could receive the third dose. Almost half the eligible public have received the second dose, which is rather satisfactory, and among the eligible citizens, almost 70% of those 60 or above have received the third dose. I met some experts this morning. And we came to an agreement, and the Department of Health might announce a shortening of the interval between the second and 3 doses in order to enhance the protection among the public. For children, the vaccination drive started relatively late, and as such, for children aged 3 to 11, only about 19% have received the first dose. And by mid-April, we hope we can achieve a vaccination rate of 90%. And for this, we would need the support from parents. Through our outreach teams and vaccination centers, we would allow students or children to be vaccinated, but at the end, we would require cooperation and support from parents. We saw that 3 young children pass away, and we hope that parents would see the need to protect their children. In the past 2 years, children lacked social activities due to the class suspension. As such, they did not acquire the necessary immunity. If they are infected with the Omicron strain, they would be subject to great risks. So I call for parents to take proper care of their children and arrange for them to be vaccinated in order to allow them to grow up healthily. In terms of residential care homes for the elderly, the vaccination rate has reached 34% or 1/3. Some of the residents are not fit for vaccination out of medical grounds. Our target is to achieve a 90% vaccination rate no later than April. For residents of residential care homes for the elderly or for the disability, they are living in these care homes, and so long as they are fit for vaccination, we can administer the vaccines. So manpower is crucial. So the question is whether we have sufficient manpower to administer the vaccines at the 1,000 odd homes. Over the past week, 3,600 residents received the first dose, which was more than 10 times the previous figure of about 240. In terms of our anti-epidemic work, the SAR government would like to thank all parts of society for joining hands with us. First, I'd like to thank the healthcare sector, including the hospital authority and the private sector. Everyone has played their part in fighting the pandemic, and we are happy to hear that the HA has agreed with private hospitals the transfer of some patients to private hospitals for treatment, and this would alleviate the burden on public hospitals. The Chinese medicine sector has offered proactive support for people who are waiting for quarantine or isolation at home. They have offered Chinese medicine services, and the Baptist University Chinese medicine team has provided online consultation and diagnosis services for confirmed patients free of charge. As for private testing contractors, over the past 2 years, they have expended a lot of energies in supporting our testing operations, and the HKU team and laboratories in supporting the government's sewage surveillance exercises, the property management sector for taking part in our quarantine scheme to support those who are quarantining at home, as well as the hotel sector. About 20,000 rooms are being provided, which is much higher than the original target of 7,000 to 10,000, and they have leased their hotels for conversion into community isolation facilities. At the beginning, they only agreed to provide their premises but not their staff, and we would have to deploy our own staff at these hotels to deliver meals, etc. But now 70% of the hotels have agreed to mobilize their staff, and we only need to deploy a small number of staff members. So once again, I'd like to thank the hotels for their support. The taxi trade and minivan trade have also provided their support. by providing designated fleet, while universities and self-financing post-secondary schools also earmarked parts of their campus for testing or vaccination purposes, and they have mobilized some of their hostels. In terms of the community service organizations, we have retirees and healthcare workers who have offered their support. For the business sector, measures to support the government's anti-epidemic initiatives have been floated by offering sites or offering in-kind donations. So we urge employers and the business sector to offer rental concessions for their tenants during this difficult time. And in the process of fighting the pandemic, inevitably there would be conflicts between employers and employees. So we are seeking to clarify the definition of sick leave so that employees can require their employers to pay sick leave allowance in accordance with the law. For those who must be quarantined or isolated, they could take sick leave. If an employer dismisses an employee who needs to receive compulsory quarantine, that would be seen as an unreasonable dismissal. So if an employee is dismissed just because he or she does not use a vaccine pass, it would not be seen as an unreasonable dismissal. So while we implement the compulsory universal testing, we hope employers would allow their employees to get tested on time. Finally, to overcome the pandemic, support and cooperation from the public is essential, and we are talking about everyone in Hong Kong. We must all support the anti-epidemic initiatives. So once again, I have a few reminders for the public. First of all, please continue to observe social distancing and refrain from going out unless necessary. And we should not attend mass or cross-family gatherings. And in terms of the government's restriction testing declarations and compulsory testing notices, or the future compulsory testing notices, you should get tested on time. If you hire foreign domestic helpers, you should discuss the rest day arrangements with them and urge them to refrain from attending gatherings during their rest days or in holidays. Please pay extra attention to personal hygiene, and if you are exposed to high risk, please take a rapid antigen test as soon as possible. And if you have elderly or elderly household members or children at home, please get vaccinated as soon as possible. And having said that, there is no need to worry too much, and you can chat with your family members or friends often to find out how they are doing. The government must provide accurate and efficient information for the public, and I always believe there's room for improvement. That is why in the policy address delivered last year, I have talked about how we can deliver messages more accurately and efficiently. And since February the 18th, RTHK 32 has become an information channel for the pandemic, and pamphlets for the vaccine pass have been delivered to every household via Hong Kong Post, and next week through Hong Kong Post we would deliver another pamphlet containing tips on fighting the pandemic. We are in a battle, and everyone must know what they are supposed to do, and they must know where they can obtain the correct information. They can refer to the ISD website, YouTube, the Tamer Talk channel, as well as government news releases. and a number of secretaries have been assigned different roles in fighting the pandemic, and they have assumed a leadership role, and I have instructed the secretaries to take turns in explaining their work to the media. In recent times, Ms. Edward Yao talked about the supply of medical equipment. Of the 13 bureaus, only one secretary does not have to assume such role, since he will deliver the budget to is responsible for compiling the budget, and as such, the Secretary for Financial Services and Treasury has not assumed a role in fighting the pandemic. For the remaining 12 secretaries, they have each been assigned a role. I'm reaching the end of my term. Since I assumed office, and over the past 4 months, I have talked about the importance of confidence. So I have some words of encouragement for everyone. Hope is what drives a society forward, and confidence is the cornerstone of hope. Over the past 3 months, Hong Kong faced unprecedented political and social turmoil and 4 waves of the COVID epidemic. But with the support of the central government, we were able to overcome difficulties and restore order. And again, with the support of the central government and with the togetherness of the Hong Kong public, we will overcome the pandemic, and we will see the rainbow at the end of the storm. So we urge everyone to maintain confidence, and I call for the media to share more encouraging stories in fighting the pandemic. So hopefully we can all overcome the pandemic. We now proceed to question and answers. Please raise your hand and identify your organization before you speak, and use the microphone as you speak.
咁首先
At the back, the gentleman in green. I'm from Ming Pao. 3 questions. First one. Mrs. Lam mentioned just now you will boost the testing capacity to 1 million. So does it mean that there will be mainland experts collecting samples and taking them back to Shenzhen for testing? Would that be the arrangement? And what about bringing, human cells back to the mainland? That involves a legal issue. How are you going to address that? And then many people are concerned about their privacy, and they may resent such an arrangement. So how would you handle that? Second question is about the compulsory universal testing. How would you actually do the law enforcement without lockdown? Would it, undermine the effectiveness of such a move? And finally, we don't have enough isolation facilities. How come you're still pushing forward with the compulsory universal testing? Is that your decision or the decision of the central authorities? Thank you. 3 questions. They all have to do with testing. Well, we've been fighting this epidemic for 2 years. I'm sure you would agree that early identification is important. Otherwise, silent transmission chains will spread in the community and at different blocks and so on, and then the situation will snowball, and we won't be able to handle it. It's like in this case now. So the best early identification tool is testing. And we've always been using the PCR test so far. We're still using PCR test now, but then there are new discoveries actually. In Hong Kong, actually, we have developed the rapid antigen test, which is approved by the USA. So now we have a rapid antigen test as a supporting means for testing. I do the RAT every day. All the directors of the bureau do it every day. So testing is very important, and we need more testing actually, and that's why we need universal testing to with so many transmission trains around. And with universal testing, it is a major exercise, involves the deployment of much manpower and resources. And so we are still working on the details. I've only just given you the framework of the scheme. And Mr. Eric Chung is responsible for designing and implementing the compulsory universal testing scheme. Supporting him is Mr. Patrick Nip, Secretary for the Civil Service, because we will need tens of thousands of civil servants to be involved in this exercise. Now, if we don't test people, it's because we don't want to fight the battle. But now we want to fight the battle, so that's why we have to mobilize all the resources we have to fight it. Now, if we fight the battle, does it mean that other work will be affected? Well, it's not necessarily the case, because the compulsory universal testing will be done over a certain period, and we'll announce the details later, as I said. And then when we do that, some non-essential public service may have to be suspended because we need to deploy all the people to the front line take forward the compulsory universal testing. Of course, there will be tight manpower supply. One has to do with sample collection, the other has to do with laboratory testing. Now, the local testing contractors have been working really hard. Before the fifth wave of outbreak, our testing capacity was less than 100,000 per day. But now we have reached a capacity of 200 to 300,000 tests a day. Still, that's not enough. And that's why the waiting time is a bit longer for the results. That's why we need help from the central authorities, so that we could boost our testing capacity to 1 million tests a day, and the results must be made available within 24 hours. Otherwise, the test would not be useful. So to do that, we need people to collect samples. That's the first thing. And second thing is we need laboratory testing capacity. And that's why we need help from the mainland. Now, if we don't have enough sampling staff, of course, we need someone to be sent over from the mainland. Some batch or two of sampling staff workers have arrived, and in fact, many of the local testing contractors, they employ sampling staff from the mainland to help out. And if we don't have enough laboratory testing capacity locally, then we will have to send the samples to the mainland for testing. And it doesn't involve the question of privacy, because there are no personal particulars involved. There's only just a barcode on the sample tubes. And only when the test results are back in Hong Kong, they'll be matched to individuals. So there is no question of privacy, but whether there is a legal issue involving any particular piece of legislation, well, we have to look into that. But then we're talking about an emergency. And given the current circumstance, we must still do it, even if there are legal constraints. That is the mindset we should have when we are fighting a battle. When you're in a battle, of course, you won't go through the formalities to procure supplies. You won't go for tendering and so on. But if there are any legal constraints and so on, we'll certainly address them. On the law enforcement of compulsory universal test, why are we using identity card numbers as the basis for testing? That's exactly because it will facilitate law enforcement. If someone does not come forward to do the test, we will be able to pursue that person because of the ID card number. And if necessary, prosecution will be taken out and fines will be slapped on that person. Now, of course, we could do, lockdown by a small district, and then we do the universal test. It will work better, but then there is a high price to pay. So when it comes to public health, nothing is absolute, as I've been saying over the past 2 years. It is always a matter of striking a balance. We have to balance whether something is accepted by the public. We have to balance if something would deal a severe blow to our economy. Now, the Secretary for Food and Health is still working on the details, and then there are mainland experts here. They will be giving us their advice as well on the universal testing arrangement. But for the time being, we're not considering total lockdown. It's not realistic in any case, because people do have to go out. We're talking about hundreds of thousands of workers who have to help with the test, and these people have to go out. In any case, on the detailed arrangement, I'm sure Mr. Tsang will be giving you a full account when he has worked out all the details. Because we're talking about everyone in Hong Kong who has to take the test. Thank you.
Next question, please. The lady at the back, please. I'm from Now TV. Chief Executive, you just said that mainland and local businessmen donated different supplies, including drugs as well as cash. So how much of these supplies are available and how would they be distributed to the public? And in terms of your coordination with mainland experts, you said mainland experts and sampling staff might be invited to offer support in Hong Kong. How many people approximately do you expect are needed? And to build a new temporary hospital, more manpower is needed. And how much manpower do you expect? In terms of compulsory universal testing, no lockdown would be imposed. You said that imposing a lockdown might not be realistic. Did the central government recommend a lockdown for the SAR government? Did the SAR government consider such plan? And during compulsory testing, employees working in private companies might still need to go to work. So for those who cannot go to work, would they be considered taking no pay leave or sick leave? Like you said, the details would be announced by Mr. Eric Chang, but I can address the points I mentioned. Like I said, the business sector has been supportive in offering support to our anti-epidemic efforts. Basically, we do not accept cash or in-kind donations. We simply provide matching. For cash or in-kind donations from the business sector, it would be best for them to identify NGOs or charities. We have a lot of work on our hand already. If we are to, dealing with donations or distributing materials are not on the top of our list. But I do thank the business sector, and I call for them to go the extra mile by deciding what they want to do with their money and how they deal with the rapid antigen test kits. If they want to help the vulnerable groups, they can identify the relevant NGOs. But if they want us to help with the matching, we are happy to support as well. Mr. Chan Kok-ki from the Chief Executive's Office would be responsible for that. As for experts from mainland, 2 batches of experts have arrived, including public health experts from the mainland. They were happy to stay a few more days to provide support to the Center for Health Protection to analyze the current trend and cases. They are vastly experienced. These are national level experts, so I will try to meet them this week to solicit their views on the pandemic situation in Hong Kong. And we also receive a number of mainland experts who are experienced in treatment. Earlier today, Dr. Lau from DHA cited from a mainland expert, and that expert indicated that we should give more information on the nature of deaths or serious cases instead of just reporting numbers, because numbers could be intimidating. Even if we talk about the age range of the cases, we should actually provide more details. Even for a relatively young patient, let's say 40 to 50 years old, that person came from a residential care home and he had a chronic illness. That way, we can reassure the public that serious cases are not so common. You can imagine that patients in a serious condition would be hospitalized already, and there were only 49 cases in a critical or serious condition out of tens of thousands of cases. So according to the expert, we must offer more information on the severity of the cases. So this is one example we can learn from the vastly experienced experts. Since we lack sampling staff, and as such, sampling staff from the mainland have also arrived, and another type of personnel, what we call laboratory staff or personnel. So the central government is willing to offer personnel support as needed. We have identified sites for new facilities since time is tight. We have asked the central government to allow us to appoint a construction team, and the central government has appointed a team for the Penny's Bay and Kai Tak sites. And for the Loop area, for the temporary hospital and community isolation facilities, the team might come from Shenzhen, so we might commission a construction team from Shenzhen. But having said that, the legal requirements of Hong Kong must be complied with, and we might invoke the emergency regulations ordinance or other pieces of legislation to enable work to be done. The mainland personnel offering assistance should not be subject to unnecessary constraints. In terms of a possible lockdown, I reiterate that the central government never issued any instructions on our anti-epidemic work, and that is why the SAR government has always assumed primary responsibility. So the point is the central government would offer support as needed or upon our request, but of course we would always exchange our views. Testing requires prior appointment, and testing only takes a very short time. People can choose a facility near where they live or where they work, and I believe testing would not take more than an hour. In any case, for employees who have made an appointment for CUT, employers should facilitate or should offer facilitation. I think we should not see any disputes arising out of these situations. And as for the possible scenario of unreasonable dismissal, we would be amending the employment ordinance to provide a clear basis to deal with the interactions between employers and employees.
The lady in the middle of the front row.
Could you speak louder, please? Hello. Okay. Question from SCMP. So, how's the universal testing different from the mainland style? Why a lockdown, which was reported to be suggested by the Beijing government, was not implemented? Is there any estimation that how many positive cases could be identified through CUT? Many isolation facilities will be completed in the coming few months. How can you ensure that there are enough they are enough for cases identified from CUT, which will start next month? You have also mentioned earlier that this wave will be contained in 2 to 3 months. Do you have a more pessimistic forecast now? And also, how can the government ensure residents confined by CUT would have enough assistance? Will there be compensation offered to the business sector affected by the testing? And also, will the residents' mobility be restricted during the CUT is carried out? If yes, then what's the alternative on that? Thank you.
There's a whole range of issues. I try my best to answer. But I hope you understand, I want to clarify that I have not used descriptions like I'm guaranteeing that this will happen, that the fifth wave will be contained, and I will ensure that this will happen and that will not happen. It is not possible. This is an unprecedented challenge, and nobody could predict the development of this fifth wave of the COVID-19 epidemic. I met with my 6 experts this morning, including Professor K.Y. Yuen, Professor Gabriel Leung, Professor Lau Yulong, and Professor David Hui, and Ivan Hong, and C.S. Lau. 6 distinguished professors specializing in different aspects of public health and medicine. And they gave me not entirely the same advice, because nobody could predict. So I could not answer your question that whether this wave will definitely be contained within the 2 to 3 months. What I have told you is we hope to make the full use of the next 2 or 3 months, because this is critical. We probably have not seen the peak of this wave. So how are we going to manage the next 2 or 3 months will be extremely essential and critical to containing, but there is no guarantee whatsoever. And as far as the compulsory universal test, which we intend to do, there is no instruction from the Central People's Government of a lockdown. So I cannot comment on your very speculative remark that Beijing has imposed an instruction of lockdown and we have not agreed. I have explained that we are shouldering the primary responsibility for combating the COVID-19 epidemic. The country, our motherland, is giving us all the support that we need at this critical stage. But at the end of the day, I am responsible under one country, 2 systems. This is entirely a matter for the Hong Kong SAR administration to tackle. But the Central People's Government has given us all the support that we have asked for, and I'm sure we'll continue to ask for more support in terms of medical supplies or personnel or testing equipment and so on. Again, I could not predict or forecast the percentage of positive cases arisen from a universal testing. But to give you a feel is nowadays when we did the RTD, that is the restricted testing declaration, we started off at the beginning of this month, the percentage of discovery, so to speak, about the positive case was 0.5. But more recently, it has risen to 2%. And in 2 extreme cases, it was even 7-point-something%. So that's very worrying. But of course, that was not a representative sample, because that was already indicated by a high viral load in the sewage specimen that we tested. But everybody is now predicting that we will have a pretty sizable percentage of people infected with COVID-19 in Hong Kong. So hopefully the compulsory universal testing will try to identify these infected cases and put them into isolation. Now, to ensure that its success, of course, we need a lot more isolation facilities. We will keep on identifying these isolation facilities, whether in the form of units like the Penny's Bay or the CIF, that is Community Isolation Facility Hotel, or like AWE, which is a large hall, an indoor stadium and so on, which will be converted into beds rather than individual units. So all the facilities that are being identified will be built as soon as possible, and they will come on stage as soon as possible. During the CUT, at the moment, we have no plans to disallow people to leave their home because that would be very difficult to implement, because a large number of people have to go out to work, especially in relation to the anti-epidemic work. So whenever we have something that is mandatory, you have to think about exemptions, how to identify all those people who need to be exempted and allow them to go out to work in essential services and to support the anti-epidemic work or to support the financial services in Hong Kong is a very big issue. So we will not likely take a decision to disallow people to go out on a wholesale and a prolonged basis. One night is okay, 2 days may be also okay, but the CUT will take place within the month of March for 3 times. So how long are we going to lock up the people of Hong Kong? So let's don't focus on the city lockdown or a lockdown. Let's focus on how we could ensure the 7.4 million people in Hong Kong will embrace this compulsory universal testing and take an active part so that it will be a successful scheme. I don't exactly understand your point about compensation. If you refer to our prolonged implementation of social distancing measures, where we are imposing closures on a large number of premises, we will continue to help these enterprises as we did. In this wave alone, we have introduced 2 rounds of anti-epidemic fund assistance, AEF 5.0, AEF 6.0. Costing 30 billion Hong Kong dollars. We will continue to monitor the situation and do our best to help the affected enterprises. But tomorrow happens to be the annual budget day. So we'll have to see what the Financial Secretary has to tell us about the possible relief measures for the enterprises and individuals in Hong Kong. And based on that, if there is still the need to help, we certainly will help them. Thank you.
我哋問多最後2位記者。
Final 2 questions. Please limit yourself to no more than 2 questions each. The reporter at the back row, please. I'm from Phoenix TV. I have a few questions, Chief Executive. Hong Kong is implementing compulsory universal testing without imposing a lockdown. Why wasn't compulsory testing ordered much earlier? If positive patients are identified through the exercise, does Hong Kong have enough quarantine facilities? And does it mean that by implementing CUT, Hong Kong has enough quarantine facilities if people are made to wait at home, even if they test positive? What is the point of the CUT? Given the severe situation with the 5th wave of the pandemic, I would say that there is no perfect solution. That would not be realistic. Hong Kong has a population of more than 7 million people. We face thousands of new infections every day. If we use the same approach 2 years ago, it's impossible to trace and hospitalize every case. We must come up with a solution to deal with this major public health crisis. our current approach is to reinforce our capabilities, and with the support of the central authorities, we have consistently reinforced our testing capabilities, sampling capabilities, our laboratory capabilities. We are providing more community isolation facilities. When the fifth wave started, we only had the Penny's Bay isolation facility, and now we have now almost 20,000 hotel rooms are available for isolation. So that shows we have reinforced our capabilities. Even so, we might not be able to transfer the confirmed cases to the facilities on time. And many homes in Hong Kong are not fit for isolation, but for people awaiting transfer to community isolation facilities, we must provide people with sufficient resources. For instance, by distributing anti-epidemic kits, which include rapid test kits and relevant information. We also set up a medical inquiry hotline so that people can know more about their conditions. And we also designated clinics, and we arrange free taxi transportation services to bring people to clinics, and free online medical consultation service is also provided. So it's about providing the best support for people who need to be isolated, and we also urge people to observe personal hygiene and to avoid infecting other family members. In March, we will begin the compulsory universal testing exercise. Three universal tests would be administered in order to identify confirmed cases and curb the transmission chains. Details are to be confirmed. Our current plan does not require a mass lockdown because that would give rise to even more problems. So like I said, we must come up with a solution that fits Hong Kong. We cannot copy the approach of the UK, US, or the mainland. We must come up with an approach that is most suitable for Hong Kong. So with universal testing, hopefully by March, our isolation capabilities would be greatly reinforced, and we would be able to isolate confirmed cases. Right now, 30,000 confirmed cases are still waiting at home. As a whole, the scale of the fifth outbreak is unprecedented. So it's not possible to come up with the perfect answer, but we would do our best to safeguard the well-being of the Hong Kong public. Thank you very much. Final question. The lady on the back row. Chief Executive, I'm from Commercial Radio. For the compulsory universal testing exercise, what is the expected expenditure? You are coming to the end of your term. Did you mean that you have no intention to seek re-election? From your meeting with Vice Premier Han Zheng, was the Central People's Government not very happy with the performance of the SAR government? I would not answer your second question. My only priority now is to overcome the pandemic. I would not think about other issues for the time being. As for the cost of the universal testing exercise, we are yet to come up with a sum, but the sum would be substantial. That is why I have requested the Financial Secretary to reserve more funds for anti-epidemic work, and that includes more than the compulsory universal testing exercise. We have rented 20,000 hotel rooms for 3 months, and we would need to pay based on a 100% occupancy rate. That is a substantial sum, and we have many other lines of work as well. Expenditure would not be a constraint. So long as Hong Kong can overcome the pandemic, I have every confidence in Hong Kong's future. We would certainly manage to earn the money back. The only priority now is the well-being and lives of Hong Kong people. So the SAR government would not hesitate in spending money as needed. Thank you very much. This is the end of the press conference. Thank you very much.